Some Derry good news, some Derry good news. We all could use some Derry good news.
It's another week of shelter in place, which probably means you could use some Derry good news. This week's episode is sponsored by cruises you can't take anymore.
Sailing through the heart of historic Europe with Viking, you'll see things differently.
Actually, you won't see anything at all because you're not going. We're also sponsored by viewers like you. Thank you. Do you remember when we all thought the Australian wildfires would be the defining event of 2020? Ah, the good old days. I know it can seem like 2020 is a dumpster fire that's been tossed into a pile of other dumpsters on fire, but there's always good news to be found. We heard some good news this week from Pastor Marie's sermon, that we are a sent-out people even when we are staying home. The church has left the building and exists in essential businesses and in homes through our words and prayers. Though I will say, the story of Jesus appearing to the disciples in the upper room and later to Thomas isn't very COVID appropriate. First, Thomas breaks the shelter-in-place order and is off wandering somewhere when he missed Jesus. He probably wasn't even wearing a mask. Second, the disciples are not a family, and yet they are all gathered in a large gathering eating. Third, Jesus, who has already shown up to others, now shows up to the disciples. Did he use hand sanitizer first? And then, the biggest transgression of them all, he's off breathing on everyone. Not the best text for the pandemic. I'll add it to my list of hymns that are no longer appropriate to be sung in church right now. Would you like to hear them? You would? Great. And if you said no, I'm sorry, we're doing it anyway. First up, breathe on me, breath of God. No, wear a mask. Precious Lord, take my hand. No, walk 6 feet apart from me, Jesus. Just a closer walk with thee. Nope, just a social distancing walk will work right now. Draw me nearer. No, stay away in your own home. He touched me. No, he shouldn't have. Hands to yourself. Gather us in. Nope, gather in your own homes on Zoom, people. I could go on and on. We gather together, sing of the one who walks beside us. Jesus, draw me close. Christ be beside me. Negative ghostwriter, the pattern is full on all of those. Since so many hymns are inappropriate right now, I thought the good news we all need is a Pastor Stephen original COVID hymn.
I come to the garden alone because of COVID-19. It's the only way to worship Sunday while I watch the Derry live stream. So I will stay home, talk to family by phone, wear a mask to go to the store. Because I love you, this is what I'll do. Till you can't get sick anymore.
So maybe singing that hymn isn't actually good news, but don't worry, I've got some Derry good news for you. Now, I said on Easter that it'd be amazing if we could reach $10,000 for our one great hour of sharing offering, and like you always do, you came through. So far, we've received nearly $13,000. Now, I know our original goal was $22,000, but that was set long before this whole pandemic thing happened. $13,000 is an amazing amount of money during these uncertain financial times, and we'll use that money. Half of it will continue our partnership with Bridges to Community so we can continue to build houses in Nicaragua and the Dominican Republic and support families there. The other half will be used by the denomination for feeding programs, small businesses, disaster assistance. Thank you for your generous giving even during these uncertain times. It's Derry good news indeed. Now, it's hard to have a happy birthday celebration while there's a shelter-in-place order. Lauren Reed, happy Sweet 16, she received video messages from many of her friends last week, as did Lizzie Peace. Jim Royer celebrated his 65th birthday, and his family surprised him with a drive-through birthday party. Jim got to sit on his driveway as friends drove by with well wishes, honks, shouts, and music. We always find ways to celebrate Derry good news. Happy birthday, Jim, and to all those celebrating birthdays during this pandemic. If you have some fun birthday photos or videos, feel free to share them, and we will celebrate you too. We've probably all heard of people who have tested positive for COVID-19, and we've been praying for many here locally and around the country and world. I have some Derry good news that Carla Bennett, one of the first in the church to test positive, has recovered and is feeling much better. Recently, I spoke with Carla about the good news. So I am with Carla Bennett, who works at the Hershey Med Center, and she recently recovered from COVID-19, and we're glad you're here on the show for some Derry good news.
Yes, I'm glad to be here for Derry good news.
Tell us a little bit about your good news of feeling better.
Yes, I am happy to report I am recovered from COVID. I was sick for a while and isolated from my family, but I was never admitted to the hospital. My symptoms were all very manageable at home, and I'm feeling great. I am back at work, although I'm working remotely from home. I am out of the isolation phase of the illness, and I have received a lot of support during my illness, and I'm really fortunate and happy to have recovered.
What would you say was kind of the hardest symptom to manage for you?
The hardest symptom for me was the body aches. The body aches was the worst. The fever was very low grade. The highest my fever ever got was about 100.9. My cough was really rather mild. I had some nausea, and I had a little bit of the chest tightness that they talk about, but that really only lasted about 2 days, maybe 3 days, but it was very manageable. I felt like a little bit nervous when I laid flat to go to sleep at night, so I just stacked a lot of pillows up on my bed, and I did fine.
Well, that's great to hear.
Yeah.
And I hear, some places are potentially using plasma from those who have had COVID to treat patients. And I know at one point you posted something on Facebook, you'd love to be able to do that. Has that been a possibility?
Yes. The Red Cross has reached out to me, and I have registered, and I have to be symptom-free for 28 days. And once I reach that point, which they think will be in mid-May, I will be able to donate my plasma. And they are using and beginning to use plasma transfusions at the medical center for patients who are admitted with COVID, who are struggling with it, and trying to determine if that will help them, which I'm really hoping that I'm able to do that.
Yeah, it seems like that's some good news that might be a possible treatment. And I've seen there's a new drug that the Med Center is also part of kind of a global trial for as well. That's had
yes, they were just recently approved for an antiviral drug for a study for that, so they'll be working on that as well. Mm-hmm.
Excellent. So what other good news have you seen being at the Med Center and just hearing from your colleagues that can give us a bit of hope?
Well, the community has really come forth and helped everyone on the front line, and it's so heartwarming for so many of the nurses on the front lines. A lot of retired physicians have come forth and donated bags and bags and bags of like specialty coffee for the nurses and doctors who are working. I know there are local bakeries that are donating a lot of sweets. There is our local restaurant, the Finici's restaurant, that many of you may be familiar with. They have a GoFundMe page on Facebook, and local community members are able to donate and to that page. And Finici's is going around to all of our local small business restaurants and ordering numerous meals to provide to the frontline staff to help them feel supported. We've had Batman, we've had a rainbow unicorn cheering all of our staff on when they drive in.
I mean, how can you not have good news with the rainbow unicorn?
I know. Yes.
Well, we are glad that you're feeling better, that you're recovered, and we are just so appreciative for all you've done on the front lines and for all your colleagues. And thank you for sharing with us today.
Thank you so much for reaching out. Stay healthy, everyone, and the Med Center is there to support you if you need it. They're wonderful, wonderful nurses and doctors there doing really good work.
Carla, we are so glad you are feeling better, and we appreciate all you and your co-workers have been doing to care for others at the hospital during these times. Thanks for sharing your Derry good news. Now, Hershey Med has been on the front lines of COVID-19 from the very beginning, from being a part of new drug trials to finding creative ways to care for patients with COVID, protecting patients who didn't have it, and finding new and more effective ways to test new patients. Derry member Tim Moser recently talked with me about one new thing the radiology department is up to. So I am with Dr. Tim Moser, who is the chair of the Department of Radiology at the Hershey Med Center, and he's going to talk to us a little bit about the new annex for radiology. Tim, thanks for being on the show. Can you share a little bit about the new annex and why it's so important?
Yes, thanks, Stephen. So with any crisis like we're facing with COVID, I think one of the things that's an outcome of that is you get a lot of creativity and ingenuity to solve problems. And I think this is a good example about how we brought a team of people together with a lot of different experience to solve a problem that we were facing, and that is how do we take care of patients that may or may not have the disease. And when we're in that situation, we have to make sure that we keep patients separate so that they're not connecting, getting close to each other and potentially spreading the virus from one patient to another or from themselves to the equipment. Normally in an X-ray room, we can take 5 to 6 studies an hour. And so we design our rooms to be able to manage that type of workflow. But when we're dealing with somebody who potentially has a contagious virus like COVID-19, it can take 90 minutes to 100 minutes between patients to make sure that we completely decontaminate the room and don't expose the next patient to the virus. And so that really cuts into our ability to care for what could be a large number of patients coming in that need to be evaluated for COVID-19. So we were in the process of looking at various sites around the Hershey campus to think where we might be able to put more equipment to be able to expand our capacity. And somebody came up with a great idea of why don't we keep the patient separate from the equipment and we'll just take a picture through a window. And as we started brainstorming more and more, they said, well, let's do one step farther. Let's just keep the patient outside the building and we'll keep them separated from the equipment with a plexiglass screen. And that way they can just step out of their car, they can get their x-ray, and they can be on their way. They don't have to worry about being exposed to the equipment. We don't have to worry about them potentially spreading the virus into the room. And it turned out that was very efficient. And so now rather than being able to take an image every 90 minutes, we're able to do a study every 10 minutes. And so it was a very creative solution that allowed us to be able to manage any potential surge that we might be seeing in COVID-19 within our community.
How many x-rays do you say you end up doing a day?
It's actually been less than we've anticipated. I think we've been somewhat fortunate in central Pennsylvania that we haven't had the large surge that was seen in other areas in the country where some of my colleagues in New York City are seeing upwards of 100 new patients per day. We have typically I think we've only seen 270 in Dauphin County. Within the X-ray areas that we've been using, we've been averaging about 8 to 10 studies per day. So not a large volume, but the nice thing is with this system is that we know if we had to do it, we could take care of a really large volume at that site. So it gives us some security of knowing that we do have the capacity to meet the needs of the population.
Do you think that's that low numbers are attributed to just where we're at, or social distancing, or a combination of factors?
It's a combination of factors. I think we were fortunate, and I think within our area we implemented a lot of the social distancing factors fairly early on, and we never really saw a large spike that we were kind of planning for. So I think we spent a lot of time really planning to manage the surge that was seen in other areas of the country, and we've been fortunate that that we haven't had the level of disease in central Pennsylvania that has been seen elsewhere. But you still need to plan for it.
Absolutely.
And I think we're still in an area of that uncertainty, knowing if it's still coming. Although certainly the data over the last week has been very encouraging.
What good news do you see kind of at the hospital around the COVID and the pandemic?
I think just the way people pull together. It's a nice thing about working at Hershey is it's a very collegial environment. But I think the level of collaboration and cooperation of people just coming together to be able to solve problems that we've never anticipated we'd have to be facing has been, really uplifting, and I think keeps you motivated. And it's just, it's been really inspiring to see, everybody from environmental health workers that making sure that the facility is staying clean, to the cafeteria workers, to the way the community's lifted up and supported the healthcare community here. It's been just that level of teamwork is certainly something that's been very positive news.
Well, we appreciate all our Derry members who are on the front lines, working at hospitals and other places, going and doing your job so well, and all the medical staff, whether at Hershey Med or any of these other hospitals and nursing centers. We just greatly appreciate all that you are doing.
Well, thank you. We certainly feel the support of the community. It's been really nice to know people are thinking of us, and the level of support has been great.
Well, thank you for taking the time to share with us and sharing that Derry good news.
Thank you.
Have a good
one.
Have
a good day. Yep, be safe out there.
Thanks. You too.
All right.
Thanks, Tim, for that Derry good news. It's great to know the hospital is planning ahead and is willing to adapt to care for our community. Thank you for sticking around for another episode of Derry Good News. I hope you aren't disappointed if we return next week like Thomas was when he saw Jesus after the resurrection. Isn't that right, Tommy? You're not going to live that one down anytime soon. Until we return next week, find some and be some Derry Good News.
Imagine the look on Thomas's face. Tommy, what do you think doubting Thomas's face might have looked like as Jesus walked into the room after saying over and over again, "I doubt it. I don't believe you're telling me the truth." What do you think his face looked like when Jesus walked in?
I probably feel like he was a little disappointed.
You think he was disappointed?
Yeah, like
to see Jesus?
Oh!
Some Derry good news, some Derry good news. We all could use some Derry good news.